I know she is not letting a teenage girl walk into that room herself. That a real psychiatrist would absolutely never do. Oh my gosh, okay. Gonna need a moment. I'm gonna need to collect myself. This is insane. I'm just truly in shock by what I'm seeing right now.
I've read your book, Unlocking the Outcast Mind. Came in very handy when I was grooming Tyler.
You'll forgive me if I don't use that as a pull quote in the next edition. I thought keeping you two apart would diminish your emotional hold over him.
But it hasn't. And now you want me to tell you how to unlock my little monster.
I want to know what you did to Tyler so that I can begin to rehabilitate him.
Rehabilitate? Is that what you do here?
Okay. Alright. So, similar, I kind of mentioned this earlier with Wednesday, that you wouldn't enlist the help of, I said, a teenager to help you in your case. You would not go to another patient at another mental health facility to get you to help you on a current patient. And again, what happened to all the other options? What happened to peer consultation with mental health professionals? Why are you asking another patient to help you? And again, this is a breach of his confidentiality because she is still very much implying that Tyler, how he's doing in treatment, which is a breach. So implying that he's getting better or getting worse. Even if she's not specifically saying that he is, but she's implying, hey, this bond isn't weakening, I'm not able to help him out. So sharing information about a patient's prognosis, no matter if it's somewhat vague, is breaking confidentiality. So many issues here in terms of reaching out to another patient for help, which we would never do. And in general, just once again, not keeping information confidential. Oh, and I did want to highlight here that we do get a little bit more of a sense. Earlier in the video, I talked about how Dr. Fairburn doesn't seem like she has clear goals for Tyler, so that makes it difficult to actually know what to do with him. So she did clarify here that there's goals for rehabilitation, but again, what does that mean? Maybe she has a clear idea, which would be really great, but I don't from hearing that. So I'm still curious of what rehabilitation would look like. Does that mean that he never transforms again? Does that mean that when he does transform that he's not violent? Does that mean any host of things that it could mean that is just not clarified here?
Now, are you willing to help me or not?
Only if you'll agree to have me transferred here permanently as a patient.
That will be for a jury to decide. Well, I'm sorry we couldn't make this work. I'll have to find a more invasive method to unlock Tyler. Arrange her transfer back to Northern State Correctional. And please note that I recommend the prisoner be placed in solitary confinement until her trial.
You've made your point. I'm willing to help. All I ask is that you let me see Tyler face to face.
Nothing frustrates me more than this depiction of, I think it happens a lot with psychiatrists, but just this depiction of being really arrogant and manipulative and threatening to try to get your way, being domineering. And I think a lot of the reason that there's this portrayal as psychiatrists as being arrogant, it's not always, I think, 100% untrue, and hear me out, medical doctors, psychiatrists, is that in doctoral school, so in med school, a lot of times it's so competitive, and it kind of creates that atmosphere to where you have to just fight for survival and be the best to get noticed and to move forward, and you just kind of have to be in that state almost. So when you get to the point of being a medical doctor, I think there can be a lot of that arrogance that patients can feel in just how things are said in just such an abrupt way, and I'm the professional, I know what's best, so you're going to do this, and somebody will say, what about this? And you're like, no, you're wrong. Like, you're wrong, that treatment doesn't work, or that medication doesn't work, or blah, 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 which I don't think they're necessarily meaning to be arrogant. It's just that they have this knowledge of it, and the way that the training is, there often isn't necessarily that training of saying, how do you package this to somebody? So I think a lot of times people might have experienced this when they go to a psychiatrist or medical doctor, but this isn't the case for all psychiatrists and medical doctors. And so I do hate that this is the prevailing portrayal of it when that's not always the case in reality. Although that kind of is the case for Dr. Fairburn. Also, you would never threaten a patient. Like, we have to remember what roles were in here. I think Dr. Fairburn is just really letting her emotions get the best of her. And she even brought her here. I'm forgetting the name of this woman for a moment, the redheaded one. I'm so sorry. But even brought her here basically to just use her for information. So when she's saying, which is her right, that no, I'm not going to help you with this, now she's threatening her? Like, this is not okay. And I want to specify that this is not okay. Oh, wow. I was going to say, before they show the scene right away, that if she takes her there, that is just wild. And she actually does take her to see Tyler. So if you truly think it is not in the best clinical interest for somebody to have a visitor, then you should not bring them there. Like I said, sometimes the courts themselves can restrict visitors, but also the place that a person is being a patient of, so whatever psychiatric ward or state hospital, they also have a right to say, you know what, it is not in this person's best clinical interest to see X person, especially if you feel it's going to negatively impact their treatment, cause them to regress, etc. So in this case, when she's specifically saying that the bond between them two is very strong and she thought time away would loosen it, but it hasn't, why is she bringing her in to see Tyler? It's literally just so she can get what she wants, right? That now she can use this kind of bartering, and that is not how this works. This is a professional relationship. She should not be trying to barter for information and advantages and whatever else. So this psychiatrist has just completely lost her way of what the ethical guidelines are and what it looks like to be doing true therapy and just be a true clinician. I'm just very disturbed by what I'm seeing here, but let's disturb myself more, I guess, and keep watching.
It's okay. Here. Mama's here. Oh, I know, baby. I missed you too.
I've been dreaming about this moment.
Don't hit the shock collar. It'll kill her.
Okay. Oh my gosh. So this is why a lot of times a person will not go in by themselves to see somebody. And in this case, she doesn't go in by herself, like Dr. Fairburn is there as well. But also, if you're having a visitor, and if for some reason you're visiting them like in their quarters, you would be far enough away to where they couldn't physically harm you. And it's the job of us as the clinical professional and also the security to remind you, because sometimes you can get too caught up in the moment. Like Dr. Fairburn, or not Dr. Fairburn, sorry, the I keep forgetting her name. I feel so bad. Whatever her name is, the redhead. She keeps walking closer to the cage to get to Tyler, and as she's doing that, Dr. Fairburn or the security should have stepped in to say, like step back, or don't get too close, or if they needed to, maybe even pull her away if she's not responding. So that's on them, honestly, that Tyler was even able to grab her, and if she gets seriously harmed in this case, like they are at fault for that, and that could be a big problem. So let's see, because now they're in a situation to where they can't even control it. Now it's all in Tyler's hand, because like she said, they can't shock him because it would cause him to kill her. Probably he would grab on too tight while he's being shocked, and it would just suffocate her. So now she's in a predicament.
I know you're upset. Just calm me down.
Oh my gosh, if I'm her, I'm suing that hospital and getting away with my millions. She would definitely win a case against Willow Hill, Dr. Fairburn, for allowing that to happen to her in that structure. She should have never been close enough for that to happen. So, I mean, and listen, I'm not on her side, because as we know from season 1 and right now that there's a lot of issues that she has, but she would be entitled to some good compensation for that. You can tell just by Dr. Fairburn's look that she is just like disgusted with her. And that might be the case internally, but you see how she just never hides or never not necessarily to hide, but tries to even see what's going on in a professional light. Like she is just letting her initial emotions escape from her in the way that she talked about Tyler being manipulative with Wednesday, and now this look that she was giving what's her face. So she just lets those emotions slip, and as professionals, that's why it's so important to be constantly doing peer supervision and doing our own reflection, because if she was doing peer supervision, the way that she's talking about and thinking about him, another therapist could point out, hey, you're really, talking about the patient in this way. Did you notice that? And bring that to her attention. And if she's self-reflecting herself, she could see some of her biases and hardships in working with some of these folks. So I think with some of what I'm seeing, it's interesting because some of that could be signs of burnout too. Like when you get to such a stage where you are almost like apathetic, where you don't care to be professional, you don't care to try to see things from a client's perspective or to work well with them. She's threatening folks, like she's just giving away confidential information willy-nilly. Like at this stage, she is a liability. And so what I'm seeing, honestly, is it could be a sign of burnout, even though she's kind of holding it well to where she's keeping this kind of monotone and seeming like she's in control of the situation to where you could think things are fine, but there is a problem here.
We have Fester Fumagalli.
Oh, now she's with Fester. I can only imagine how this is gonna go. Oh gosh, let's see.
Fester Fiesta. What is your real name?
It's just Fester. Like an open wound.
You do understand you're in a psychiatric hospital.
Her question could have been appropriate if she wasn't doing it in kind of a condescending tone. You could tell she wasn't saying that to actually try to get information and see if he understands orientation-wise where he is, which is appropriate for her to do, to make sure that he's kind of in touch with reality. And so you want to figure out if a person's oriented to the place, to the time, to the situation. So she'd want to get a sense and kind of figure out, does he know that he's at a psychiatric facility? But the way that she's asking it, you can tell that it's kind of almost rhetorical, pretty condescending, to be like pretty sarcastic, to say, you do know you're at a psychiatric hospital, right? So she's not asking it for that reason, but I want to mention it would be appropriate if she were asking it for that reason.
My parents abandoned me when I was 10. They said it was summer camp, but they never came back.
Tell me what you see, Fester. Death. Death. An ice cream cone. Wait, turn it that way. Still death.
I've been shocked so many times in this video. I feel like I'm just speechless at this point, but I know this has been a problem, especially with the Rorschach, which is what she's doing, the Rorschach ink blot test. Those are real ink blots. Like, at this point, the Rorschach isn't even valid because so many people watch Wednesday that I can't believe it is so irresponsible of the producers and creators of the show to put out the real ink blot on something that is so popular, but they probably don't even understand some of the negative consequences of doing that. Some of the issues with this is that if people study these well enough and look at it ahead of time, you don't get their real responses. And so what happens is they've had time to think about it and might craft something that doesn't actually tell you about them. So what the Rorschach is meant to do, it's meant to be a personality test, and based on how somebody answers, it's supposed to give you good information about their true personality. But if they are answering in not an honest way, having not seen something for the first time, then it wouldn't be accurate. Just like, for instance, when I went to grad school, we would do, in our first year, we did psychological testing or psychoeducational testing. So we did a lot of testing for people for learning disabilities, ADHD, things like dyslexia, even autism a little bit. And so with those things, right before we did that, our professors told us, if you want to figure out what your IQ is, then do it now. Because once we start doing this testing, you will never be able to test your IQ again. That's because we give those IQ measures We've seen them a million times. We know the questions, and we, as the people giving it, know the proper answers. So I could never do that honestly. The test would be skewed and say that I am a genius when I am very much not. And so the issue with them showing this is just that they are really just polluting the test. Huh. It makes me so sad to see that. And also, she's not administering it in the right way. One, she's not taking any notes on what he's saying after the ink blots. I mean, he's just giving an information about death, but she's supposed to prompt him for more information in specific ways, so she's not asking additional questions. They're not seated correctly, so there's actually a special kind of seating that you would have for doing the Rorschach. And yeah, so nothing about that was actually accurate, by the way. Except the fact that the ink blots were accurate, which is scary.
You never forget the cold embrace of your first straitjacket. Is that an amenity you offer here?
Welcome to Willow Hill. We have a very long journey ahead of us.
Nothing like a good jolt to get this party started. Any chance I can get a second round?
Oh, and good. We have another incorrect portrayal of electroshock therapy. If you want to understand more about electroshock therapy, check out the video that I did on that. It looks nothing like what we just saw.
My connection to Tyler runs deep. I'm the only one that he trusts.
Is that why I watched him try to snap your neck?
Well, he thought I had abandoned him. If you really want to get inside his head, we'll have to do it together.
Do you honestly think that I don't see through your delusional fantasy?
I have information I know you will want to hear.
I very much doubt that.
Fester Adams.
In terms of some of the questions that she's asking, she's being very short because she's trying to just get information and get what she needs from this woman and basically use her and then throw her out. But even some of the way that she's asking, like I wouldn't ask, oh, is that the reason that he tried to snap your neck, right? I might say something a little bit different to maybe still get at the same idea of, okay, you say that he trusts you a lot and he did try to harm you before, like he did try to kill you. So help me to understand how you feel that he does trust you but could do something like that. You see how the way that I just said that is very different than her saying, is that why you tried to snap your neck earlier? And if this patient wasn't so forthcoming with a lot of this information, that could have stopped conversation right there. Like, if it was me and I was on the end of talking with Dr. Fairburn, I wouldn't want to talk to her. I mean, she's just so abrasive, and you can tell, like I said, she's using her and very threatening. And so the way that she's asking questions and her demeanor does not make it open to make me want to be more, forthcoming with her. So, yeah, again, I think big signs of burnout from what I'm seeing, just tiredness and not going through things as they should be. So yeah. Okay, so I think that's all of Dr. Fairburn that I can take today. If you haven't guessed it yet, my rating of her is not going to be favorable. I'm going to give her an F. Probably an F minus. Like, not an F as in like a 30%, but probably like a 0. Honestly, for me, the confidentiality thing amongst so many others is so glaring that just cannot be excused. For no reason should you be breaking your client's confidentiality, and she did it constantly without any kind of remorse or any kind of care. And so with that, I don't care if you're giving somebody the best therapy in the world and they're learning so much and getting so many breakthroughs. If you are breaking their confidentiality willy-nilly like that, then you do not deserve to be in the position that you're in. You should just be removed, simply. And I want to have a little bit of empathy as well. Like, it could be if she is truly experiencing burnout, then she should herself get some help and get some time away from this role, and maybe with her own rehabilitation can come back and be successful. But right now, as it stands, no. And one of the things that I want to say to just generally wrap up, I think the idea with when it comes to patients in a psych ward and what she's kind of showing is that for some reason there's this prevailing stigma that people in a psychiatric ward do not deserve the same kinds of dignity or protections that people outside of these facilities get. Like, for some reason, just because these people might be more symptomatic, maybe experiencing more psychoses, and might not be as in touch with what's going on, people might think, well, it's okay if I betray their confidentiality or their basic rights. Like, it doesn't matter. It's not that big of a deal because of what they're experiencing or the setting that we're in. And that is absolutely not the case. These are people who deserve the same kind of rights and protections as other people. And yes, there are some more stricter policies in psychiatric wards, and sometimes when it comes to confidentiality, things are a little bit different. But there's nothing that happened here with Dr. Fairburn and giving out this information to Wednesday or other people that was okay. And I want to address too, something that we see here is often with the more difficult clients. So this could be people, say, with personality disorders, where they might be more manipulative and dismissive and not interested in treatment. Kind of like what Dr. Fairburn is doing. What she's doing is weaponizing his confidentiality, the information that he gives, as a way to kind of get back at him. Like, she's kind of saying, okay, well, he's manipulative, so see, I'm going to talk about this, and I'm going to mention this. And so sometimes it can feel like I'm going to break confidentiality or break some of their rights that they might have because they're being overly difficult, and that's not okay either. So I want to say these can be tough settings to work in, and I really empathize that it can be incredibly difficult. I spent a very short amount of time, around 4 months, on a rotation that I was doing, just doing groups and not even like a full day in a psychiatric ward, and it can be very difficult. But there were a lot of parts about it that were super rewarding, and working with those folks, I can see just the great people that they are, and like I said, they do deserve some kind of care and true treatment. And so in this case, I think that this just isn't the setting for Dr. Fairburn too. Maybe she could really do well in a less acute setting. I don't know, but as it stands, she needs to lose her job. I don't even think I could take it, seeing how much further she could go in abusing her role as psychiatrist. So hopefully, from all that I've said, you all know that this is not an accurate portrayal, is not okay. And if you ever have a psychiatrist that's doing any of these things, please run for the hills.